Hello dear students, today we are going to learn about the mesoderm and its derivatives. Mesoderm forms after gastrulation from the epiblast and its fate decided during the third week of gestation and depending on the site of entry of the epiblast cells through the primitive streak, mesoderm differentiates into the paraxial, intermediate and lateral plate mesoderms. The paraxial mesoderm is just lie adjacent to the notochord and neural tube. So, it forms the axial musculoskeletal system. First, it divides into somatomeres in cranial region and somites in the caudal region. These somites and somatomers then differentiate into three different structures. First is sclerotome, second is the myotome, third is dermatome. Sclerotome forms the skeleton, bony skeleton like vertebrae, ribs, base of skull, and associated ligaments like annulus fibrosus of the intervertebral disc. Myotome forms the skeletal muscles of the trunk and limbs, like muscles of the back and muscles of the limb and body wall muscles. Dermatome forms the dermis of the dorsal skin lying over the vertebral column. And each somite retains its segmental innervation that explains the dermatomal pattern and myotomal supply in referred pain. Now come to the intermediate mesoderm. This mesoderm lie just next to the lateral plate mesoderm. This is the neural tube. This is the primitive node and primitive streak, and this is the paraxial mesoderm, and this is the intermediate mesoderm, and lying laterally is the lateral plate mesoderm, and most lateral is the extraembryonic mesoderm, which do not derive from the epiblast. So the intermediate mesoderm forms the urogenital system, that is the kidneys, ureters, gonads, and Wolffian and Mullerian ducts. Wolffian ducts in male and Mullerian ducts in female. Intermediate mesoderm, which forms the urinary system, initially present as pronephros, then mesonephros, and the definitive kidney forms from the metanephros in the adult human. And the ureteric buds form the ureters. Gonads like testes and ovaries, stroma and supporting cells all derive from the mesoderm. And the genital ducts, Wolffian ducts in male, which forms the epididymis, vas deferens, seminal vesicles. Mullerian duct in female forms the fallopian tubes, uterus, and upper vagina. And partial part of the adrenal gland derived from the mesoderm, that is the adrenal cortex. However, the medulla is derived from the neural crest cells. Now come to the lateral plate mesoderm. Lateral plate mesoderm lie just next to the intermediate mesoderm and divides into the somatic, that is the parietal layer, and the visceral or splanchnic layer. Parietal layer lines the body wall and it's adjacent to the ectoderm. It differentiate to form the dermis of the ventrolateral body wall and limbs, bones and connective tissues of limb and sternum, all the parietal layers of pericardium, parietal pleura, parietal peritoneum. Limb bud mesenchyme. Splanchnic layer lines the organs and is adjacent to the endoderm. It forms smooth muscles and connective tissues of the gut wall and respiratory tract. Visceral serous membrane like visceral pericardium, visceral pleura, visceral peritoneum. In heart, it forms the epicardium, myocardium, and endocardium. Blood vessels and blood cells formed from the hemangioblasts are also derived from the lateral plate mesoderm. Spleen in the dorsal mesogastrium also formed from the lateral plate mesoderm. Now come to the axial mesoderm, which is the notochord. Its direct derivative in adult is only the nucleus pulposus of intervertebral disc. It is the only definitive structure retained in adults. However, it plays very important roles in the induction of the neural tube, somite differentiation, and left to right axis establishment. Clinical correlation include the chordoma, a tumor, a rare malignant tumor derived from the notochordal remnants, and typically in the clivus and sacrococcygeal region it occurs. Cardiac mesoderm is the anterior splanchnic mesoderm. It derives from the lateral plate mesoderm and it forms the heart structures like endocardium, myocardium, epicardium, endocardial cushions like septa and heart valves. It also forms the major blood vessels like aortic arches, large arteries like dorsal aorta, pulmonary artery, aortic arch components. And it also forms the outflow tract structures like conus arteriosus, truncus arteriosus. It also forms conduction system of heart like SA node and AV node. It also form the parietal and visceral pericardium. Now come to the hemangiogenic mesoderm. Hemangiogenic mesoderm also derived from the lateral plate mesoderm. It forms a common progenitor cell known as hemangioblast, and that hemangioblast differentiates into the angioblasts, which forms the endothelial cells of the blood vessels and lymphatic endothelial cells. Second is the hematopoietic stem cells. And hematopoietic stem cells form all cell lineages of the blood, that is the erythrocyte, leukocyte, and platelets. Sites of hematopoiesis are very important, and the first site of hematopoiesis is yolk sac. It appears around third week of gestation. However, it presents only for a transient period and disappears after some time. The definitive hematopoietic stem cells or definitive hematopoiesis occurs in the AGM region or aorta gonadomesoderm or um, the definitive hematopoiesis occurs in the AGM region or aorta gonad mesonephros, and after the AGM the fetal liver takes over the hematopoiesis and it remains the major hematopoietic organ in the gestation period. However, Gradually, all the hematopoiesis shifts to the bone marrow and remains there lifelong. Key signaling pathway in hemangiogenesis are VEGF, that is vascular derived endothelial growth factor, FGF, Notch, and PROX1. PROX1 helps in the lymphatic system commitment. So today we have learned about the mesoderm and its derivatives. Thank you.